I am so happy to be here today to talk about innovation and the exciting companies that I'm involved with. And MEND is a company that I co-founded, and the MEND program is Patient-Centered Multimodal Care that is combining clinical nutrition with doctor-validated care plans supported by coaching from nurses and dietitians. And the idea for this came because, as you mentioned, I'm an amateur triathlete, which means that I get injured a lot. So I had an injury that put me in the hospital, and I needed surgery on this shoulder. And I went through this experience and was really given very little information. So from a patient journey perspective, the nutrition was never mentioned. And really, once I got out of surgery, I was handed a packet of information when I was barely out of anesthesia. And I said, there has to be a better way, because at least I have a science and health background and I can figure these things out. But what about patients who have no knowledge? And really that was the genesis of saying, could we take a program and really wrap around it this coaching that's going to allow people to be more successful? And the use case that we chose was total joint replacement. And one of the reasons is I'm sure everybody knows at least someone who's had a knee or a hip replaced. And these are elective surgeries. And there's an acute moment of need. So you have the patient in this journey before the surgery so you can prepare them and really start to understand their lifestyle, their underlying health conditions. Then you support them through the surgery and the recovery. And this period of time, that's about 6 months, allows you to get people to ingrain those healthy habits. So after this acute health event, then it focuses on their chronic needs for the rest of their lives.
That's wonderful. Looking at the patient holistically, right? I would like to ask you, looking back over the past 2 decades, what significant milestones or breakthroughs do you believe have shaped the trajectory of digital health?
So this is really interesting because I loved Zina's presentation this morning, and I'd like to show a video which is some of the innovation that I did at GSK actually much longer ago than you would think, because at GSK I was the liaison with MIT Media Lab. So we did a lot of work there in connected health, and early in the days of connected health, where we had great ideas, but in many cases the world was not ready for our innovation. So the video that we're going to show basically was a collaboration between GSK Consumer Healthcare and Vaccines, and we were the 2 smallest divisions of the company. So we were doing like really breakthrough things, and we collaborated on this connected health opportunity. But what happened is the technology was really nascent. It was too early for the technology, and the world wasn't ready. And you'll see the application where I could talk about the technology, but from the consumer perspective, there really wasn't enough smartphone adoption at the time. There was also a lot of concern about the regulatory viewpoint on, what is this? This device, this application, how is personal healthcare data being handled? So there were so many barriers in our way, which have now been cleared, through the pandemic. With, if you think about telemedicine and the adoption of even something as simple as a QR code, it's really opened up, the ability to have all of these innovations that we dreamed about 10, 15 years ago. Let's see, is it possible to show the video?
QuitBand is a wearable sensor that responds to changes in skin conductance associated with stress. Linked to a mobile app, it can alert the user to situations where increasing stress may trigger a nicotine craving. Mr. Smith has decided to quit smoking, and he's consulting his doctor to discuss his options. His doctor recommends a nicotine vaccine, but cautions that nicotine replacement therapy may be needed to help overcome cravings during the first phase of the treatment. To help Mr. Smith beat his cravings, his doctor suggests using QuitBand, a discrete wristband that incorporates a sensor designed to continuously monitor stress and uses a phone app that alerts the user if they're at an increased risk of nicotine cravings. Through the app, the user receives biometric feedback and information about their progress, which helps them to resist the urge to smoke during the early stages of treatment. As Mr. Smith goes about his day, the stresses of everyday life start to show. Fortunately for Mr. Smith, the quit band alerts him to his rising stress level before he feels tempted to reach for a cigarette. The mobile app also shows a visualization of the vaccine blocking nicotine. Reassured by the information, Mr. Smith opts to chew nicotine replacement gum and records his choice using the app. Mr. Smith reviews his progress with his doctor. His records show he's smoking less often, using nicotine replacement when appropriate, and learning to resist nicotine cravings altogether.
Yeah, this is the kind of technology that empowers patients to take a more active role in managing their own health care. So how do you see the progress of the digital health landscape through this digital technology evolution?
So there's been amazing progress, and just the technological limitations we had back then. We were modeling smoking cravings with PTSD. So we were looking at galvanic skin response, and there was some correlation, but not enough. And of course, as sensors and the technology has evolved, there's the ability to look at all different, change in heart rate, like multiple factors to really understand different types of stress and landscape it and have more personalized solutions. We had none of it back then. So, the technology caught up, the ability of big data to then analyze and look for trends. All of these things have built. And what's interesting is to go back to some of those early applications and say, now that all the infrastructure is there, where are some of those ideas that weren't, they were too soon, for prime time, but now it's prime time, and that's what's so exciting.
Brilliant. In what ways have patient expectations and behaviors changed as a result of increased access to health information through digital channels?
So this is really exciting for patients to have information to take agency for their health. I think that the delivery of healthcare has become so impersonal, and healthcare is really personal. And I think acknowledging that every individual is the expert on their own health, having these digital tools and having people have the visibility to even their risk factors allows them to modify their lifestyle and really take charge of their health.
Thank you, Helene. Can you tell us a little bit, describe what boards you are sitting in currently and what advice do you find to be the most helpful for the companies?
Sure, yes. So as you mentioned in the introduction, I have some really exciting announcements to make today. So I have been sitting on the Science Advisory Board of Archaea, which is an ingredient company. But what I'm really excited about is especially building on the work of MEND and being in the digital health space. Today I'm announcing that I'm going to be advising Oberit, which is an addiction recovery platform. And really exciting Birthview, who you're going to hear from later, from the founder and CEO, who is Roshane Sasson, who's here. And I'm announcing today that I'm going to join as the president and COO of Birthview.
That's so exciting. Congratulations.
Thank you.
Can you tell us a little bit, how do you stay up to date? And that's for everybody in the room. With the latest developments in technology, you know how fast technology is moving every day. We heard it also from others who talked to us about generative AI and clinical models and innovations in the industry. And how important do you feel is the continuous learning and adaptation of these technologies in your career?
So continuous learning is absolutely essential. And in fact, what I have to say is when I was building the solution for MEND, I actually took coursework at the Columbia Business School Digital Health, and that's how I got involved with HitLab. And it really was like that just-in-time knowledge. So like as I was developing things and being able to learn from best practice of all the companies that are associated with HitLab was invaluable. The other thing that I really like to do is to stay up to date on adjacent fields of science. I like to look at a lot of aggregators and see what's happening, because innovation really comes from this cross-pollination. And I like to stay in touch with emerging scientists. So I've always hired interns and find that, we get the really current ideas and knowledge. And even my 2 children are in STEM. My daughter's studying chemical engineering, which was my major. And my son has just gotten back from Madagascar doing some exciting research in the microbiome. So like just immersing myself in everything that's going on, I think, allows me to see trends and make connections.
That's brilliant. Always be humble and look at the new technology innovations that can come from anywhere. And there are a lot of innovation companies in the past that always talked that innovation follows certain templates, like a systematic inventive thinking, that repeats itself, but you just have to have awareness around you. Thank you for sharing. What are you looking forward in the future, Helene?
So I think the promise of digital health is really exciting. And for me, what I saw is the potential to democratize access to healthcare, because if you could take the best doctors in a certain field and really digitize their expertise, and that's what we were doing at MEND. We started with our MVP with an excellent surgeon, and we were able to understand the things that he was doing to make impact for his patients. And if you could digitize that experience and then add new clinicians on and they're learning and really have a lower cost way to roll that out to people, that'll overall improve healthcare.
So experience your daily life and look around you. What are the problems? And try to find real solutions. So what do you see as the promise of digital health? And what do you find as the most rewarding and hopeful for the future?
So I'll start with the most rewarding. I think that when you take a viewpoint of considering the multiple stakeholders that you're impacting with your solution, the ability to reduce stress for frontline workers, we were able to hire a care team of nurses that were in the ICU during the pandemic and allow them to have a telehealth solution, which gave them better work-life balance and less stress in their lives. We heard from the office that there was low friction in our solution, and most importantly, the patients. Like when you get the patient feedback, we had one patient actually say, "I'm living my best life now." Because if you look at how people are living before they have a joint replacement and their mobility is reduced and they can't do anything they want to, and then they go through their rehabilitation and now they're playing with their grandchildren again. So like hearing that feedback, those personal stories is so rewarding. And I think for the future, what you're saying is, through the use of big data and having people know their risk factors earlier in life will allow them to take a more preventative approach to their health and minimize those lifestyle preventable chronic conditions and really increase their health span as opposed to just their lifespan.
So what really fuels you is this exponential impact in healthcare and society.
Absolutely.
This is magnificent. It's a pleasure having you here and have this discussion. Congratulations again, Helene, to your success.